Hi, everyone, and welcome to RDP's Open House. I'm Malin Crawley, and I'm the chair and an instructor in the Medical Lab Assistant Program. So I'm here to give you a brief overview of the MLA program. We're going to start with some admission requirements, go over those, and also talk a little bit about the practicum that's involved in our program. I've also included some pictures of our MLA lab for you to look at. We're really proud of this learning space, and I've included some equipment and some training aids that you as a student will work on if you choose our program. And so I really hope you enjoy this video. And without further ado, let's continue and let's look into the MLA program. Let's start by looking at the program requirements. So our program runs for 29 weeks in total. So 22 weeks you will spend at RDP and 7 weeks will be your clinical practicum. Admission requirements. So the minimum average of 60% and no mark below 50% in English 30-1 or 30-2. Chemistry 20, Bio 30, and Math 10C or Math 20-2. We require our MLAs to be competent keyboard specialists, so we ask that you do a keyboarding skills test for us. You need a minimum of 30 net words per minute with a minimum accuracy rate of 97% on both samples. You will complete this using an online program called Typist. Some other requirements are of required immunizations. So once you're admitted into the program, the college will send you the list, and you'll take that list and you will be required to update all immunizations on that list. You will also be required to provide a police information check. It was formerly known as a criminal record check, and you also need to include a vulnerable sector check. After you've successfully completed all courses at RDP, you will proceed to your clinical practicum. This is a 7-week rotation at an AHS facility. So all students are expected to travel to the clinical sites and are responsible for all costs associated with that travel and living costs. Careful consideration is given for student preferences for practicum location. However, students may be required to travel to locations outside of their preferences. So this last paragraph is worth mentioning, I feel, to all students. We give you the opportunity to choose 4 placement sites from a list of places that have agreed to train our students. But I want everyone to know that, every effort is made to place students in one of those 4 choices. However, sometimes we cannot place the students in those choices. So I think it's an important piece of communication to all students so they are aware. Let's look at some duties of an MLA. So MLAs are frontline workers, right? We're often referred to them as the face of the lab. Blood collection, of course, is a big part of your job. ECGs as well. Giving patient instructions when collecting non-blood specimens. Urinalysis testing, so we'll teach you how to read the urine strips, and also a urine sediment using a microscope. And here's those typing skills going to come into play again. You will enter data into the lab computer system. So that's a big part of your job. Let's look at a typical week of the MLA student at RDP. So you will have lectures and labs in this program. So lectures, you're going to have 5 courses. It's about 14 hours per week. You will take 3 MLA core subjects, integrated medical terminology, so that's medical terminology, anatomy, and some testing. And you will also take a healthcare communication class. Now the labs, you will have 4 labs a week for a total of 8 hours. blood collection, specimen processing, lab equipment, urinalysis, ECGs, hematology, histocytomicro, and also healthcare communication has a lab component. So if you notice my importance stamp here, this is just something that I always communicate to students and parents alike, just to bring some awareness, right? This is not meant to intimidate you or scare you or anything. It is just for information, right? So this program is a fast, intense, short program. So please do not equate short with easy. It's very busy. The students are very busy. And in this short time at RDP and then into their practicum. So just bringing some awareness to this program and to the students that are interested. So now let me give you a small tour of our MLA lab learning space and some of the equipment that is in here. So you're looking at one side of our lab actually. So you can see that there's student workstations on the left. The training arms you can kind of see on the bedside tables. We have all hospital beds, so you learn to raise and lower the beds, and of course the students will lay on those beds and get tested by each other. We have some computer workstations, so we are very well equipped, and like I said, we're pretty proud of this learning space, and yeah, it's a great space, and it has all our equipment in there. So we even offer some drop-in lab practice. So outside of the lecture hours, you can come in and you can practice and hone your skills. This next picture is all about blood collection, and so again, this is a big part of an MLA's job and a big part of our program. So we have our training aids. You can see one of the arms, and it is hooked up to some fake blood. That blood comes in a jug, and we just fill those bags up. So when you poke the training aid, you will actually get blood in your tubes, so we can teach you how to mix them, what tubes that you need to collect. And then once you are competent on these training aids, then we move to poking each other in this program actually. So you poke each other under very, very close supervision of an instructor. And so, yeah, so that's how you progress. And so every lab time, then we, learn about the different tubes and the tests, and also, of course, there's different needles. And yeah, so this is a really fun lab and fun part of our course. So this is a really nifty piece of equipment that we have. We have a small hematology analyzer. And so the students will run this analyzer. So you learn to run some controls on it. And you learn all about quality control in the lab. And once you collect your patient specimen, you will actually run the CBC, or the complete blood count, on this analyzer. So it's a really nifty little machine, and we use barcodes, and yeah, we're really lucky to have this piece of instrumentation to teach you all about quality control and about running a patient specimen. So using a microscope properly, and as I said earlier on in the video about reading urine sediments, so that's what we really concentrate on in this program. And we have beautiful mics, as you can see, so the students, you will learn to operate that set Kohler and look at blood smears and actually urine sediments, which is a big part of one of the core courses in the program. So yeah, again, very lucky to have really state-of-the-art equipment at RDP. Thinking back to my slide about typical duties of an MLA, you notice that ECGs were listed, and so here's our brand new ECG machine and trolley. And yeah, so the students will practice ECGs on each other, and of course the ECG is electrocardiography, so taking a picture of the patient's electrical activity of their heart. So you will learn all about ECGs and how to properly perform one. So the next piece of equipment that I'd like to show you is called a Clinitech, and this is our urinalysis analyzer. So you can see that we have a multi-sticks urine strip in the tray there, and it gets sucked into that machine and it gives you a printout. And so we'll teach you all about how to dip and properly dip and read a urine. And yeah, they're fun little instruments to operate. And the last picture that I wanted to show you with the lab is the back lab bench now. So we have a lot of storage in there, and on the top of the counter on the left you can see those blue lids, and those are centrifuges, and that's what we spin our blood in to separate the plasma from the whole blood and serum from the blood clots. And so we can test plasma or serum with the help of those machines. So we'll teach you how to balance those and run those. And as you can see, we have dirty sinks and hand washing sinks and a drying rack. So we have a lot of goodies in our lab. And yeah, it looks nice and shiny and new. And yeah, it was new in the fall of 2017. So again, very, very proud of this space and all of the equipment that we have. So thanks again for watching our MLA video. If you need more information or would like to talk with us, we're going to hold a live session with all prospective students during open house on Tuesday, November 2nd from 7:30 to 8 p.m. So you'll be provided with a link so you can just click on and yes, talk with one of the instructors and just ask any questions that you have, and we'll be happy to answer them. Thanks again, and we look forward to you joining us in the fall 2022.